Assalamualaikum and a very good day to our lecturer Dr. Faris and fellow students. So today, me and my teammates will present about the healthcare ethics for the engineering ethics and Oshe. So I started with me. My name is Shamimi binti Muhammad Rus and Yushmita and Kinesh. Okay, now I will be explaining the first slide. The healthcare ethics. Ethics in healthcare is what guides the work of professionals in the healthcare industry. These considerations are the essential component of providing healthcare as they help ensure practitioners treat their patients with dignity and respect, and that the decisions made by the healthcare professionals are fair and just. So next is the principle of healthcare ethics. There are four main principles of healthcare ethics, which are autonomy, beneficence, non-maleficence, and justice. Let's dive more into it. The first one is autonomy. It mandates that healthcare providers educate patients about their options but refrain from making decisions on their behalf. Even if a healthcare professional believes a specific treatment is optimal, autonomy grants patients the final say. The second one is beneficence. This ethical principle entails enhancing patient well-being and health by administering treatments to alleviate pain, prevent harm, and foster health. It serves as a cornerstone of healthcare ethics, guiding practitioners to evaluate the potential benefits and risks of each course of action and recommend intervention they believe will optimize patient outcome. The third one is non-maleficence. Non-maleficence serves as the counterpart of beneficence, emphasizing that healthcare practitioners must do no harm and avoid causing harm to patients due to negligence. Then the last one is justice. This means ensuring that patients are not denied access to care, face barriers to healthcare, or receive lower quality treatment due to factors such as economic status, ethnicity, gender identity, or other characteristics. So I will pass to my next member.
So the three considerations in healthcare ethics. First, truth telling, informed consent, respect of autonomy, confidently, protection of personal information, only sharing private information on need to know basis. Fidelity, follow job description, what work it is, work within creditly. Loyalty, maintaining duty of care of all, no matter who they are or what they may have done. An approach to ethical analysis and justification in context. Step 1, analysis the ethical dimension of healthcare issue and context. What are the risk, harm, and concern? What are the appropriate healthcare goals in this context? What is the scope and legitimacy of legal authority and which law and regulation apply? Step 2, formulate alternative courses of action and evaluation their ethical dimensions. What are the short and long-term options? What are the ethical dimensions and tension of each option? Does the healthcare action provide the best balance of benefit of over harm and other causes? Step 3, provide justification for a particular healthcare decision. Is the healthcare action likely to be effective? Is the action necessary? Can decide maker of offer public justification in the policy and culture's context. Next, the all location of limited medical resources during an pandemic. For instance, during the COVID-19 pandemic, hospitals faced the ethical dilemma of deciding who receives life-saving treatments such as ventilators when they are not enough for everyone who needs them. I pass to my second teammate.
So previously it was the example, and now we'll be explaining about the solution for that example. So firstly, the development and implementation of clear and transparent guidelines for resource allocation. These guidelines should be based on ethical principles such as maximizing benefits, treating people fairly, and prioritizing the most vulnerable populations. Additionally, healthcare institutions can establish such committees composed of ethicists, healthcare professionals, and community representatives to make critical decisions about resource allocation in a fair and transparent manner. Furthermore, investing in measures to increase the capacity of healthcare systems and manufacturing capabilities for critical medical supplies can help prevent future crises and ensure equitable access to healthcare resources. So this is the second example, which is the issue of informed consent in medical research. In the past, there have been instances where vulnerable populations such as prisoners, minorities, and or individuals with cognitive impairment were exploited or subjected to unethical experimentation without fully understanding the risks involved. In order to solve it, we have to strengthen the regulation and guidelines surrounding informed consent in medical research itself. This includes ensuring that participants are provided with clear and understandable information about the purpose of the study, potential risks and benefits, and their right as participants as well. Additionally, researchers should prioritize obtaining voluntary and informed consent from individuals who may be vulnerable or have diminished decision-making capacity. Implementing rigorous oversight mechanisms such as independent ethics review boards can help prevent exploitation and ensure that research adherence to ethical standards. Moreover, fostering a culture of transparency and accountability within the research community can promote ethical conduct and protect the rights and well-being of research participants. So previously, we have seen two examples, two solutions, and now we are in the end of this session. We will do summary of it. So the crisis stems from conflicting priorities of quality care and responsible resource management. Key issue include equal access due to socio-economic gaps and balancing individual autonomy with public interest. Ethical dilemmas faced by healthcare professionals involve end-of-life care and resource allocation, profit-driven commercialization, and lack of consensus on ethical principles for the conflicted merits. Resolving this requires prioritizing ethical policy, offering independently with dialogue and promoting integrity and so that's all from all of us. Thank you.